cancer diagnosis is a life-changing event for anyone, right? It's gut-wrenching, it's emotional. It can be confusing also understanding the diagnosis and the treatment options. As Dr. Jaymeson Stroud is with the Ackerman Cancer Center. He's here to help us better understand what every patient needs to know if they were ever to receive a cancer diagnosis. Good morning, thanks for being here.
Good morning,
Appreciate
it's great to be here.
So a diagnosis often involves something called the stage of the cancer. Would you explain exactly what that means?
Sure, yeah, stage is very important. It represents the extent of spread of disease. It factors in the size of the tumor, whether it's spread to lymph nodes or whether it's spread to other parts of the body.
So something else then that a doctor would discuss with you then also would be grading,
right,
which is different from that.
Grade is different than stage, definitely. So grade represents how aggressive the cancer looks under the microscope. So grades can be 1 to 3, and oftentimes when you hear a doctor say maybe there's a bad cancer, quote unquote bad cancer, it usually refers to the aggressiveness, the grade of the cancer.
Okay, so that is worse than the stage.
Well, stage is the most important factor in predicting and in looking at prognosis, but grade definitely factors in.
And how does one over the other, basically designate what your treatment options will be?
Good question. So, for instance, you could have a low-grade cancer that's spread everywhere and it's stage 4, unfortunately, or you could have a high-grade cancer that's caught early and it's curable. So curable stages 1 through 3 are typically considered curable, and even stage 4, sometimes you can have some long-term survivors based on, the appropriate treatment.
Why do you think it's important for someone who receives this diagnosis to understand that?
Yeah.
The difference between the two.
It is important because, whether you have a low-grade cancer or a high-grade cancer may factor into how aggressive your treatment is and how intensive maybe you need some chemotherapy in addition to radiation therapy. So it will definitely factor into prognosis and treatment selection.
So if you get a diagnosis that involves a high-grade form of cancer, for example, does it mean it's more aggressive, and does it mean that your prognosis is not as good as you'd like it to be?
It can, but if you get on top of a high-grade cancer that's localized quickly with early detection, you can cure that with a lot of success.
I think this is why it's important also to remind our viewers about the importance of listening to their body, right? Absolutely. When it comes to, and also regardless of what the cancer is, but there are so many options in terms of preventing certain forms of really aggressive cancer, in particular in terms of preventative care.
Absolutely, absolutely. And even second opinion is important because you can look at a certain opinion that maybe doesn't have all the options available, and if you go to another physician, maybe there's a different philosophy of treatment. For instance, I saw a patient yesterday who originally came to me a few years ago. He said, "Dr. Stroud, my other doctors won't look into why my PSA is going up." Come to find out, he had a high-grade prostate cancer. Fortunately, his PET scan showed that it was localized, and we treated him with proton beam therapy, and as of yesterday, his scan showed no evidence of recurrent disease.
Yeah, I think that's such an important point that you make, because I think that there's the shock of absorbing, that kind of announcement that someone may receive from their doctor that telling them that they have cancer, and then not knowing, where do I even begin? How do I find a doctor, first of all, a reputable doctor, a doctor that has a good reputation? I think we all think that all doctors are good, and I'm not saying they aren't, but finding and knowing where to look is difficult, and getting that second opinion is important.
Yes, absolutely. And even if they just reaffirm the first opinion, it's at that level of comfort that you're getting the treatment, again, treatment that can save your life.
Doctor, thanks for being here. I appreciate it. We hope that no one ever gets that diagnosis, but should they, and knowing the right questions to ask is certainly important.